Well, hello. How are you?
Um,
Uh-oh. Is that me? I hear feedback.
yeah, I don't know.
I'm like, is it me? I don't know. Well, you're cool. I hear you good now. Hopefully, I still got to figure out because when I listen to the replay, sometimes you're low, and I don't know why. Right? Look, you see, you have to think of all the things, all the things. Welcome to my world. Welcome to my world. Okay. Well, let's get this party started because, Lord, we have lots to talk about. Lots to talk about. Okay. Well, welcome to the Saturday Morning Tea, where we discuss health information, news, education, and certification tips. I am Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And before I introduce my co host, today's episode is sponsored by the Professional Reimbursement Network's free email course on the 5 steps to become a certified marketable medical coder.
Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder.
I just love that commercial. That was the very first one I did. I did it all by myself. I was so excited. Yes, yes. I was like, I'm watching people's stuff. I was like, I could do that. You know me. I'll look things around 50 times, turn it inside out. Look, I was like, I could do that. And so I put that together, and that was my very first one. So I'm excited about it. I play it all the time. Anyway, if you are interested, feel free to check out the video description box on YouTube and Facebook. And if you are in Clubhouse, you can check out the link at the top of the page. So joining me today is my illustrious co-host, Mr. Jesse, the registered trademarked, the coding nurse. Sir, introduce yourself and tell the folks all about you. You doing all the things, just all the things. I love it. I love it. Well, thank you. I'm glad I'm back too. I almost didn't make it back. Let me just explain to you how these seniors almost killed me. Literally. Literally. Well, before I go there, let me tell you, I'm a little disappointed in you Philadelphians right now. I was supposed to go to a concert last night to see Kindred, the Family Soul. And they were coming from Philadelphia and they didn't, something happened and the plane wouldn't make it. And so they had to postpone the concert. And so I was not a happy camper because I was so excited because yesterday was my day out of quarantine. Yes, I said these people tried to literally kill me. It was my day out of quarantine. So we get on this bus trip and I had to remind myself, see, it's their vacation too. I'm here trying to see and experience, it's their vacation. And trust and believe they were vacationing. So while you may think the bottle of water was bottle of water, it was that other liquid stuff. While you may think the cup, the can of soda was a can of soda. It might have started as a can of soda. Half of it may have still been a can of soda. It was a little something else added to it. But hey, who am no judgment ever. Enjoy yourself. This is your vacation. Enjoy yourself. But what did it was the 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 bus driver. Some wasn't right. I had a conversation with the bus driver, and when I walked away from the conversation, I knew at that point something ain't right here. And I understand, you know, we're at the point where you folks are just hiring whoever they can hire to do whatever job they needs to be done, and this was a clear example of that. Because dude was trying to tell me he was a nurse, a LPN. He was just telling me all of this. Like everybody he talked to, he had a story to kind of match up with whatever it was that they. I was like, sir, I just need you to get me from point A to point B safely. Every time this man drove us somewhere, he used a GPS. I use a GPS in my own city. I'm trust and believe. I'm okay with the GPS. But how you gonna get lost every single time you're using the GPS? So we was lost every single time. So they have missed several things that they were supposed to do because they showed up late, because he got lost. It was a mess. So then for whatever reason, the South was unseasonably warm last week. It was like almost 100 degrees for several days. The bus overheated. Not once, not twice, but 3 times. And stopped. Like, nope, I'm not going anywhere. Good luck. Enjoy yourselves. So I was like, okay, here we go. So then the first time, the bus driver contacts his company and tells them, "Oh, everything is okay. I got it." Do you do? Do you really have it? No, he didn't. The second time, he pulls us into the emergency room of a hospital, or emergency department parking lot of a hospital. And he pulls that bus into where the emergency vehicles are supposed to park. Like we just need to rest here a little bit, so the fluids, so he out there pouring fluids in so the fluids can churn or whatever. And I'm like, now I'm no mechanic. I don't play around. I go to the dealer. I don't play around with none of my cars. My cars last forever. I don't play around. But I do know that if your car is hot and you put an antifreeze in it, that don't mean it's gonna go. And if it goes, it's only gonna go enough to get you to help or get you to what you need. So then the last track, and we were trying to get him to get a bus to us, like have them send us a bus. And he kept telling them, "Oh, I got it. Sir, you don't have it." So we were trying to get to Knoxville before it got dark. That didn't happen. Bus stops on the side of a mountain. Do we on the bus? It's a slant. This is how he parks up against the side of the mountain, on a slant. Now we have elderly people on this bus. I think the oldest lady was almost 94 years old. There's walkers, canes, etc. Not to mention the water that's not water, the soda that's not soda. So we were in an emergency situation. It's hot, all kinds of stuff. So 911 was called. Paramedics came out, EMS came out, fire trucks came out, because the people where we were, they know they roads. This was a very, very volatile spot. They've had plenty of accidents right here in this spot on this side of the mountain, because you still had to go around this curve. It's dark. You can't see your hand in front of your face dark. It's all of the things. So there are 3 men on the bus. They have walkers or some type of issue. Then there's another man and the driver. And then there's me. So at this point, I become good Samaritan, and I have to help every single person because we in an emergency situation for real, for real. It's once the EMS came on, they're taking blood sugars and blood pressures, and everybody's stuff is completely through the roof. So we're trying to get everybody off this bus. So they take them to they have a school bus that's coming to take them to a senior center. All this. So I have to touch each and every single person. It's an emergency. Now, if you know me, you know how I am about COVID and all things COVID. I normally am double masked when I go outside. I have hand sanitizer, whatever. We're in an emergency situation. I don't have on no mask. I ain't got on no gloves, and I'm touching all these people. When I get home, I couldn't talk. Not at all. So even if I wanted to come on and talk to y'all, I could not talk. And so I'm thinking, oh, because it's hot and we go in and out of air, which was the norm when I was working in office settings. Like I would always have a summer coat or whatever because going in and out of air just does something to my whole system. So I'm like, oh, okay, here we go with the little summer coat, whatever, whatever, whatever. No, it turned out it was COVID. So I'm getting the calls like, 4 or 5 seniors then tested positive. Are you kidding me right now? So we recommended that everybody go test. I said okay. So I think at last count, I think they were up to like 10 or 15. I said, Lord Jesus. So yeah, we're surviving. I said the senior trip that's trying to kill me. For real, for real. They tried to take me all the way out. But the one good thing is prayerfully I was vaccinated and boosted and all of the things. And the only thing I had was that first night was fever and the cough. And I still have a little residual of the cough, but I'm good. My friend, one of my friends who was a nurse who had COVID, she was like, oh, and I'm sleepy. That's the other thing. Because they kept telling me, you can't lay down. Don't lay down. I was like, well, how am I supposed to sleep if I can't lay down? It was like, you got to sit up. You can't lay down. You need to sit up. And so I've been sitting up for the last week and not happy because I can't get in my bed. And then I'm trying to protect my husband because, of course, he wasn't on the trip. So he's still negative prayerfully. And we keeping him at bay. Like, you do stay in the basement. Don't come up here at all. But then I wear my mask and tell him to wear his mask if he comes in any of our common areas. And then I'm spraying stuff and wiping stuff. And it's like a disinfectant bubble over here in my world. But yeah, they tried to kill me. Needless to say, what would we do if these seniors took me out? But but I'm glad to know. I'm glad we here. It's all good. And yeah, but like I said, the Philadelphia people, I was so upset. And my husband just chuckled because I was so adamant. Like, if I don't have no symptoms and everything is good, they told me I can go out. So let me go. And I couldn't go because they postponed my concert. I was so hot. I was so mad. Well, see, we didn't know. We had no idea. We had rain. But yeah. But then the thing was, like, they didn't give us the announcement until like an hour before the concert was supposed to start. Could y'all have let somebody know before then? I wouldn't even got dressed. Like, we all dressed up with nowhere to go. And so I was teasing him like, well, can we just drive around the corner or something? Can I just can we go somewhere? He was like, no, go back upstairs. So that has been my adventure. But it was fun. Savannah was beautiful. I love the movie Midnight in the Garden of Good and Evil. I got to see all kinds of stuff in Savannah related to that. We didn't go to a beach. We did see some water. I'm not happy that I didn't get to see didn't go to a beach where I can put my foot in water. That's a little different for me. But I got to see it, and so it was all good. And I got great pictures. So I was happy. Even with the result. Thank you, Vicky. She said she's glad I'm feeling better. Hold on. La la la. He said she can hear you very low. See, I don't know if it's on my end or your end. We gotta troubleshoot that.
I mean, but you can hear me fine, right?
I can hear you fine. I can hear you fine.
We got to see. I knew what it was. I mean, not last week, but the week before.
Mm-hmm.
I realized what it was, but it should be fine now.
Okay. Hmm. Okay. Yay, yay, yay. So this week, I guess I'll start us off. So those of you, even though it wasn't last week or week before, we had the um, medical coding geek, and that was fun. That was so much fun. I'm looking to see like, well, who can I get on this fun like that again? So let's. I'm putting a list together to tackle off. So if you got some people or you think you want to hear some folks, let me know. I'll reach. You know me. I'll reach out to you. Hey, I don't know you, and you probably don't know me, but I want to bring you to my show. But that was fun. But the week before that, we talked a little bit about um, evaluation and management. And um, when the new changes that came about in 2021, we knew that there will be changes that will be coming forth for the other areas of evaluation and management. And true to form, the AMA has been kind of hinting at and trickling some different things to expect for January 1, 2023. They actually released a CPT editorial summary that kind of goes over what some of those changes are. Again, full details haven't been released. It's just a summary, but you know we like to be prepared, get ready, stay ready, so we don't have to get ready. So we know some of the things that are coming down the pike. They are getting rid of a proposal of getting rid of um, observation codes 99217 through 99226. They are looking at revising the initial and subsequent inpatient codes. Of course, if they change how you level um, the codes, that would be expected. Revision of observation and so I guess they're going to combine them because it says observation or inpatient care services, which is that's going to be real interesting to me because especially with the 2 midnight rule and all of those, that's going to be real interesting. That's going to be real interesting.
Like currently there are observation codes and then there are same day admission and discharge codes.
Mm-hmm.
So do they mean them or do they mean like combining those two? Because I could possibly see some kind of thing with that, but I don't know about.
But they're not the same. So when you're in observation, you're not formally admitted to the hospital. So your in and out is you have a formal admission. You don't have that with your observation. So I don't know. I got to see some. I got to see what the verbiage is talking about because that sounds like it's gonna be messy to me.
If they're going to get rid of it, then something's coming, or there's going to be something to pick up that slack.
Right. But then they still had the observation piece in the title of the the section. So I don't understand that. But we'll see. There's more to come. Little things to kind of pique our curiosity because it got me. I'm like, well, whoa. Wait a minute. What you mean observation or inpatient care service? And excuse me. And I know they are the way they level the service is pretty much the exact same. But again, it just depends on your site of service and which codes that you would select. So I get that and I understand kind of pulling it that way, but that means you got to be real meticulous. You got to really be on point in understanding which site of service that you're coding from and which. Yeah, that's gonna be it. That's gonna be it.
Because when you have people who have outpatient procedures and then they're admitted to observation, for a complication, then they're subsequently admitted, like, the codes, the principal diagnosis changes for what gets billed and all that. So if they're going to get rid of observation codes, and what are they going to do with these people who have complications, or they just won't be admitted, they'll just be admitted inpatient.
I don't know. It's gonna be a mess. I mean, and then the other part of it is I'm hoping that, and they did a good job. I will say they did a good job the first round in providing enough time and enough education and resources to get people on board with what these were, and providing the education and stuff. But I think you got a whole you got a whole different a group of folks that you got to kind of train. It's a little different, and so I don't know. Hopefully they have enough time to do it and provide a better understanding. The other thing was, let's see, they said revision of hospital discharge services, deletion of 99241, which is the lowest level of office consultation, which again makes sense because they deleted the lowest level, the way the code structure was before. um, the lowest level was very similar to the straightforward level, and so they got rid of that. And so I think this is kind of the same, in that falls in that same vein. um
I kind of like the discharge services. Kind of cut it out. It's either 30 minutes or less or not.
sir, oh, no, 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 it says both of them though. Whoa, 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 I'm sorry, I said the lowest level. It said, well, no, it's either 99241 and 99251 are the ones that they're planning to delete. And the 4-1 is for office consultation. And oh, you said discharge, I'm sorry. No, this is for consultation that they were deleting. And then 99251 for inpatient consultation, which is a whole other conversation to me because
And especially, but you know what though, that makes sense too because with the majority of with Medicare being so prominent, Medicare doesn't pay for consultations anyway, so
correct,
you couldn't bill.
correct.
So I can see that.
But people still use those codes, and I still see people billing those codes. But again, it's for the other payers, not for Medicare. But they're doing a whole revision of office consultation, which is which is crazy to me too, because the reason why Medicare walked away or backed out of using the consultation codes because people was compare appeared to be so confused on how to use these codes, and what the steps were and what was necessary in order to do them. So that's gonna be funny too.
Especially because I can see why they back away from it because the whole key to that is that report.
Mm-hmm.
So how so how much time are they supposed to? What's the time frame for them to have a report to the replacement provider? And the way that these people, the way they kick you out of hospital nowadays, they may have had access to a report but not received a formal written report. So I can see how it could become problematic, definitely.
Yeah, crazy as it is. Let's see what else. Prolonged services. They're going to add some new prolonged services codes. They are going to delete the prolonged service codes 99254 through 99357. They're going to revise 99417, which is the prolonged office NM. Emergency department is on the hit list. They're going to revise all of those codes 99281 through 99285. Domiciliary, rest home, and custodial care services, they will be deleting 99324 through 99340 and providing a whole reorganization in this subsection. So be on the lookout for that if you code in those areas. For home services, they will be deleting the home visit code 99343. They will revise 99341, 99342, 99344 through 99350. They will delete code 99318, which is other nursing facility services, and then a revision of the group of nursing facility care codes 99304 through 99310. So, of course, I'm sorry, go ahead.
No, go ahead. I'll let you finish.
Oh, I was just about to wrap up. Go ahead.
This is. I wanted to just point out to the students who might be in the audience. This is why it is important for you to study and take your certification exam as soon as possible.
Mm-hmm.
Because when you wait and you put not at all be applicable next year. You have to learn something new
That's right.
on top of what you already learned. So that's why it is important to test as soon as you complete your program.
And make sure you test. Well, that's a whole other thing. Making sure you're using the current year um, manual and manuals as well. So yeah. So again, these are some changes that you can expect coming down. You will hear, of course, they will be changing guidelines and information around that to assist you in how to appropriately use these new revised and adjusted E&M codes. So again, be on the lookout. And then, of course, we'll have more details. And then as I see things, I will definitely put things out there and post videos and all of that. But I just wanted to put this in your radar. They coming. Changes are coming. Changes are coming.
Some hefty CPC education coming out in the fall.
Just like it was before, and there's still questions around. Well, that's a whole other conversation. Yeah, but yeah. And then you had a wonderful, wonderful article or information. Now, where did you find that? Or give us some, let's, I guess, brief everybody about the information that you provided. And I did. It's in the, if you're on YouTube or Facebook, it's actually in the description box there. Sir, wait a minute. Look, because I know you've been in all kinds of stuff. The information about the World Health Organization.
That might be really something that you will find useful in your MPH program. Because it's a lot of resources. When I tell you that they go down the rabbit hole, and they have all kinds. You go to openwho.org.
Mm-hmm.
So I've got my essay written.
Go ahead.
Have it broken down by area, and they talk about they do disaster simulation. They do, like, if you want to set up a control center, like to control a pandemic, like in a city.
Really?
They have all that kind of training. Yeah.
I did see where they had and it was like language. You could pick the language that you wanted to train in. I said, oh, look at here.
And it's all on that website, and it's all $3.99.
$3.99 training.
And each course comes with, I guess whatever the criteria is to obtain a certificate. You have to, complete the course, whatever that means. Some of them, they have a score you have to get like a 70% or something on the test. But they tell you what the requirements are to attain your certification for that, for that particular course. I was really impressed. Some of it, it's still very, like we don't really in this country, we don't really worry about diarrhea and those kinds of things.
Right.
We have courses, they even have training around that, Ebola. I was shocked, and I found out about somebody made a random post on LinkedIn. So it's openwho.org.
Yeah, good information there. And they give you, like you said, they give you all kinds of options.
Yep, and if somebody's in school and they need to do a paper on something, this would be a great resource to come and do a quick little, course and get your little certificate, get your information and your resources. I was like, wow, it's so much information.
Mm-hmm. They got information on data.
Yeah.
So, oh,
really comprehensive.
I like. Yeah. Well, thank you for sharing that. And I was like, oh yeah, we gonna talk about this. We gonna talk about this. So what else has been going on this week? I mean, of course, the obvious, and my hearts and prayers are going out with the victims of not only the shooting in Texas, but also the shooting in Brooklyn as well, or Buffalo. I'm sorry, as well. So
And
yeah,
I mean, in terms of like medical coding, this is where you get to see, the full use of external cause code, because terrorism is an external cause code.
yep. And I'm sure, prayerfully, you'll be using them on a lot of these admissions, a lot of these, even just regular doctor visits, because we were talking about that. Like the trauma is going to be unreal, especially with the children. That was just so sad. I talked to my daughter, and she was like, she lives in Texas, and she's she's not near um, the city where it was near San Antonio. She's further southwest, but she's like, she just sobbed and just cried and cried and cried, and I was like, I can't get to you to console you. I want to hug you. I mean, she just cried and cried and cried and cried. She loves children, and so just to hear, she just, and this is like the other one, she was a child, or she was younger, so it didn't impact her as much. Like, you heard about it, but me being a parent, I tried to shield them as much from stuff that they didn't necessarily have a need to know. But this one, she's an adult, she sees it. It just, it took her off.
Of all of the trauma and all the things that I've seen as an adult and as a nurse, I think the worst human experience emotionally is the loss of a child.
Yeah.
It just hits people differently, and I've seen people just not. I've seen it just destroy people,
Yeah.
and I can only, and some of those parents that were talking, I looked at, I could just see. I'm like, they're going to need a lot of support and counseling,
Yes.
because they're just right now they're just in shock.
Yes.
You can just tell them. Then they're, and it's like, to be so young.
Mm-hmm.
I just can't. I just feel so sorry for them.
Yeah. And we're always making jokes. We were always making jokes when our kids got into like double digits. Like, okay, we on the downslide, they in double digits, and I'm like, these babies just hit the double digits in most cases. Like, oh, oh, mm. And then just the sheer. It was a little boy. I read an article about a little boy that he survived, and he said he shot at him, but a chair was kind of in the way, and so I guess the bullet hit the chair, but it did ricochet and hit his leg. But he just like pretended to be dead, and that's what a lot of the other kids did. Um, they just pretended to be dead. But oh my god, I can only imagine, or I can't even imagine. Seeing your classmates and everybody, because the way they said he was intentionally shooting in their faces, and it's like, that's horrible. That kind of machinery, that kind of, that's a mess.
But then, then you hear, it's a triumph of the human spirit. It just goes to show you just how powerful a force love is. There was a woman that they detained outside. They didn't even handcuff her because she was trying to get in,
Mm.
and she ended up convincing somebody to unhandcuff her. So they did. So you can imagine the scene was chaotic. So something else was going on that distracted them. This lady hopped the fence into the school and came out with her two children.
Okay. Okay. Like, I don't know what y'all doing over here, but I'm going to get mine. Wow.
Yeah.
Wow. Oh, another thing. So I don't know if you've seen the articles about the monkeypox um, outbreaks that have been happening here. So if you're living in some of those states, you may see some monkeypox coding happening in your area. We talked about this in my. I'm taking a public health and law class, and it, I already took the communication class, but some people are still taking a communication class. So we talked about this because a lot of the news media is focusing on um, the people as um, uh, men who have sex with men um, are the people who are now being infected with the monkeypox. And so all I could think of was this sounds like HIV in the 80s and when or early into the 70s, early 80s when HIV was coming out. And I was like, and then the stigma behind all of that. And it's like, why would you do that? Why would you lead with, yeah, we were at a much tolerable place, more inclusive, and such. But why would you do that? Why would you lead with that in order for people? Because then how people could be. It's just nasty. So I was like, why? I don't understand why would they do that. And I mean, in every like when I mentioned it in the class, people started Googling, and it was like every article, everything it talks about that. And I was like, why? Why? But yeah, that's some other wonderful things that we'll have to play with as coders when if you're in those areas that um, people are being impacted, and you'll see probably the.
And that's all. I mean, I looked it up. The code for is B04.
Mhm.
I'm like, oh, okay, we'll see.
You are funny. Like whatever. It is what it is.
I
Oh.
also wanted to briefly mention, and I'm like, okay, this stands a reason. So now, the federal government has weighed in because apparently some Medicare Advantage beneficiaries, risk adjustment, Medicare Part C, some of them have started to complain about uh, their Medicare Advantage programs because they have not allowed them to see, um, they've denied a lot of like outside treatment
Really?
to just yeah, and it's done to control costs,
Right.
but apparently it has made it to CMS there, and they are starting to investigate some of these denials on the part of some of these Medicare Advantage programs that it's unfair to their members.
Wow. Hmm. Oh, and one more thing I saw. Did you see about the nurse that she didn't get jail time?
Yes,
Okay. Okay. I saw that too. Like, alrighty. Not that it's good, bad, or different, but I mean, at least she didn't get jail time
right.
related to all of that.
I mean, because she admitted to her wrongdoing. I mean, they have revoked her license. So, and even the family testified against jail time for her.
Good. I mean, because it wasn't. I mean, it wasn't malicious. It wasn't intention. It wasn't. Yeah.
Certainly wasn't innocent. And the thing is, and the reason why I felt as though she didn't deserve jail time was because she didn't. It wasn't just her. The facility was also very culpable.
Very. And I feel like they just, for lack of a better term, they just rolled it down on her. Like, here you go. You gonna eat this one. No, I'm following your policies. I'm following your stuff. Now, I mean, again, her mistake was making sure she documented her stuff appropriately in that chart. We talk about that all the time. Document, document, document. So that was her.
And the same thing happened with the LPN here in Philadelphia, with the uh, with the governor's father of South Carolina. This was a couple of years ago.
Mm-hmm.
His name is Master.
Mm.
So his son is the current governor of South Carolina.
Okay.
This man was in some kind of like a facility, I think it's suburban Philadelphia, and he had fallen 5 times, and they never sent him out. So, well, apparently, on the fifth time that he fell,
Hmm.
this nurse had documented that she had performed neurocheck, and she didn't. So he ended up having some kind of brain bleed or something. So he ended up dying, and they charged her, but she avoided jail time too because during the investigation, the facility was also found negligent because it's not protocol to have somebody whenever you have an unwitnessed fall and you suspect a head injury, people are supposed to go out to the hospital to have a CAT scan, not fall 5 times if you don't send anybody out. So
Wow.
something clearly neurologically is going on.
Wow. Wow. And they were trying to get them jail time too?
Well, she pleaded guilty, so she never,
Oh, it
it
didn't
just
go through
kind
that.
of stopped it, and they didn't want no, she was on house arrest,
Mm.
and they didn't, and from what I understand, they didn't revoke her license. It's just suspended. They have
Mm.
certain times to do it.
Interesting.
Because these facilities believe you have it's proof. I mean, these are just two cases that we know about. They'll hang you out to dry in a minute.
And I tell you all the time, I mean, you work for them, but even the legal department is not your legal department. Even the compliance department is not your compliance department. It's for the organization. Usually, compliance, excuse me, should be set up as independent. Just depends on your organization, but legal is definitely for the organization. They're not for you. And they'll tell you if you ask. They will definitely tell you. Um, and a good legal representative will advise you to make sure that you have your own legal representation as well in these
One
kind of
of my
situations.
one of my former coworkers, she was going through it with this lady that they had promoted. She was a company subject matter expert,
Hmm.
and even though my former coworker had coding guidelines that contradicted what the subject matter expert said, HR told her point blank, even if she's wrong, she's right, and they're going to back her.
Wow.
So I told her, look, just get it in writing and get it explained. That's all.
Yep. Yep. Because it's crazy. There's a lot of even we used to see it a lot in these smaller um uh, physician practices where they not coders. They have no idea. They just doing whatever, and it's like, well, you do whatever the doctor tell you. He told you to put this, and this, and that's what you better put. You can't do that. The rules doesn't justify that. The guidelines don't even justify that. Um, and so it becomes a matter of going in and providing education. Um, Sometimes they want the education. Sometimes they don't because they trying to figure out how to get paid. Trying to figure out how to get paid. And it's like, yes, there's ways to get paid, but you want to get paid appropriately. You want to make sure that you are receiving payment that you can keep forever, and that you're not triggering other actions that will at some point could potentially result in you not only repaying the amount that they paid you, but then also the treble damages and additional fines and false claims and all the wonderful things that come along with that. CIAs and the whole shebang. So don't be playing them games.
Not very good.
Mm-mm. And like you said, for our professionals, definitely you have to document and you know you may be put in a situation. I think we've talked about this before. You may be put in a situation where policy may be XYZ, and you be like, I don't know, I don't agree with that, or the guideline. I have information that says what have you. Um, and it could be a situation where, do I need this job? Do I have to keep this job in order to maintain my livelihood and take care of my family or whatever, whatever, whatever? We all been there. You have to weigh those costs. And if it is the case where you do, then you make sure you document. This was the policy at on this during this time that I had to follow. I made sure that I notified or provided them information about what the guidance was. However, I was told that this is the policy of this organization that I had to follow. You document that and you keep a record. So they won't be trying to throw you under the bus.
Exactly. Well, we have Asha in the chat, and since we last met, Asha got word that she passed her
She
CPT exam.
did. She told me in the chat.
Congratulations.
I don't know if she want to come up and speak. Hey Tanika and everybody in the room. I'm sorry. I've been so busy. Let me invite folks if they want to come up. Hey Asha. You're muted if you're talking. Okay. Good morning. Did you come for the medical coding geek? Because I think I announced it that week. You don't, yeah, don't worry about it. Okay. Okay. Right, and I told you we working you out in the background so we can get you here on the video too. So yeah, we still got to connect on that as well. You
Good.
good, good. Get it, get it, get the bag, get the bag.
So, Asha, I have a question. So, what advice could you give anybody who's currently studying for their CPT?
Mhm. 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 Yep, process of elimination.
Yeah. And probably also will help you with that kind of repetition and that amount of intensity is it also helps you to memorize the easier codes that you see repetitively, like E11.9, like I10, like I11.0. Those kinds of things you know.
Wait a minute, you don't even see my expression. That's why you laughing. Because I'm like, what? But go ahead. So what do you think about um the exam changes? Uh-oh. You I'm losing her.
Breaking up.
Uh-huh. Yes.
Yeah, you were.
Right. Good.
Yeah.
Right. Right. Mm-hmm. Yeah, you have to read it because, and I would say, make sure you read it so that you can answer what they're asking you. Because we get to read and we're like, oh wait, I already know. No, read the whole thing so you can understand and answer the question that they're asking you. Because a good test writer gonna put it all in there. Good test writer gonna know. Oh, they gonna do this. They gonna do this. They gonna do that. A good test. That's what a good test writer gonna do. So So was it difficult? Because because you have taken the exam before, and so you know what the structure of the exam was prior to what they've done for 2022. Was it difficult in not knowing what section you were in when you're answering the questions, and that everything it could be all over the place? Was that difficult, or it didn't matter?
It wasn't. It was still the same order. The test is still in the same order. It's just less questions in each section.
Oh, they said they weren't going to do that. They said that they weren't going to allow you weren't going to know which questions or what sections you were in um on the test.
No,
Huh.
no, they had it broken. Yep, every series was in order. It was still with the medical terminology, anatomy. We're all in the back.
If you go,
The
I promise you. Oh, well, that's good to
the
know.
other the other funny thing is there were a couple of questions that were duplicated in one series, like say 7 and 8 were the exact same questions.
Uh oh.
But the A, B, C, and D were kind of mixed up. Then there was another question I can't remember what series, and I had to ask the proctor. I was like, "Am I seeing right?" Because A, B was two different choices, but C and D were the exact same answers.
Mm.
So if you picked C or D, it would have been right because those were the two correct answers. So there were print issues with the new quote unquote new test,
Mm.
but but that's like as a new coder coming in to take the test, I probably wouldn't have picked that up. But because I would have just been anxious and overwhelmed across the board, like,
Right.
okay, that I'm right there. But as a person now that has done it for a year and then did this whole intensive, test taking thing, I saw it immediately and I was like, wait a minute, this don't look right.
Yeah.
So, but
Now, did they document that in your like the proctors, or you document it in the survey area or whatever afterwards?
well, I didn't really have that part. I don't really remember seeing that part. And he honestly didn't really care. My proctor is was also one of the, I guess, people responsible for the chapter. So with his goal for us for as students, because he knew what we went through with COVID, he's like, listen, you guys got to pass. That's it.
Mm.
The end. The test is made to be, hard so that it discourages you, so that, if maybe you don't pass. And it's okay. You've been through it, so and you know your stuff. We just got to get you passed so that you can work. So most of us were already working in the field, even though we didn't pass the test. So his sole job was to make sure that we got more confident and that we passed. He didn't even care about the test, and he's a chapter, rep. He just was like, this is about networking. This is about helping you in your career. This is about I don't want to offend anybody on the call, but this is about, opening doors to people that look like us and encouraging us to create, community.
Mm-hmm.
It wasn't even so much about what AAPC plans to do and how it governs. It's like knowing how it governs and still being able to pull somebody up and help. And that's just what he did.
Good. Well, that's excellent. And where are you located?
I'm in New York.
New York. Okay. Well, good. Good.
Yeah. And that was helpful also because the school then allowed us to take the test. Where if you look online now at AAPC for the 2022, 20, yeah, there are really no tests in this area.
Really?
And that was concerning as well. Like if I have to take it again, and I need help, like if the school didn't jump in to help, we would have probably be still stuck till 2023. So
Or face the option of the virtual exam.
right, that. And I don't know anything about that, but then that's a whole nother hoop,
That is a whole
and
other
you're
hoop.
trying to prepare for a test, and now you're talking about 2 days of testing. That's, it's already a lot of anxiety with test taking. You don't want to add more to it. So I was very grateful that they presented an opportunity where they would host, and because AAPC didn't open an opportunity. It was either go out of state or drive upstate, and that's like 5 hours to
Wow.
stay overnight to take the test in a whole nother county that's far from me. Yeah, so
Well, again, congratulations. Thank you.
Oh,
That's what's
Yeah.
up.
So
That's what's
now
up.
I can. So now I'm just looking at ways to get the A off. They told me a lot of different things that I could do. That because I had experience already, so I'm working on that now, and then I'm applying for work. So
Well, cool. Well, we appreciate you. Thank you so much for sharing your experience.
definitely.
That's what's up.
you
Did you have a question, Mr. Jesse?
No.
Okay. Cool, cool, cool. All righty, all righty. Well, we are at the top of the hour. Um, let's see, let's see. I don't think I have anything else on my docket here. Did you have any last words or anything that you wanted to share, sir?
No. We can keep it like this week. You're on the men, and
Right.
we got it back. We're back in our cycle.
We back in our cycle, so we be back here every Saturday. I don't think I have. Oh yeah, we got to talk about the. Well, that's a whole other thing. Yes, I'm gonna need you to stay on a little bit if you can.
Okay, sure.
These people driving me crazy. I promise you, they driving me crazy. Um, but yeah, so we can talk about that, and how we want to introduce some new and exciting things for you all, to help you in your goal of certification, or uh, yeah, pretty much primarily the goal of certification, or a goal of just knowledge, because some people may not necessarily want certification, but they want the knowledge of coding, and how it could potentially help them. I know, like, excuse me, some compliance professionals may not necessarily want to be coders or not coders, but they need to have a comfort level and information on, well, what is coding, and what is the guidelines about, and what is all of that. So they need, like, probably a baseline level. And so we've been talking about putting together some type of um, program for that, where we, do a little segment related to that. So yeah, we still got it in the purview. We still looking at it. So okay. Well, again, thank you all for joining this Saturday morning tea. Was the tea spilled today? I think so. I think so.
Absolutely, yes.
And then following up with Ms. Asha with the information on
Yeah.
exam, we definitely got some tea spilled. So Ms. Asha, I probably will take your pieces and chop that up, and you'll be seeing it all over YouTube. um, so if this information was valuable for you, go ahead. You're muted. What'd you say? You're unmuted. No? Okay. Well, they can't see you; they can just hear you. But, or maybe I'll contact you and we can do we can do something. We can do that too if you want to do something better, or something more formal or structured. We can do that too. I'll reach out to you and we can figure out how we want to do that. Okay. So if this information was valuable for you, help us share this message with others by liking the video. Yes, yes, yes. Miss Vicky said that the tea was spilled. um,
Yeah.
yes, yes, yes. So in sharing the video and subscribing to the channel, the Professional Reimbursement Network, you can also check out the Coding Nurse channel on YouTube. How your class is going, sir?
Let me tell you. So I have a current class which is coming along fine. It's in week 3, so week 2 is always rough because that's the causal relationships and combination codes with I-11, I-12. So they were looking like they had been run over when we were doing our quiz. I mean, my phone was hot that week.
Well, you already know. You already know to prepare. Like they gonna come. They gonna come out of here shook. Like, wait a minute, what did I do? What did I get myself into?
So I was planning on having another class in next month, but then I realized I'm like, wait a minute, because normally I had people chomping at the bit, because like these people, they were ready to go weeks before I even had this class, and I'm like, oh, this is really the first summer we have not been in some kind of lockdown.
Mm-hmm.
So I'm like, oh,
everybody in these streets.
Yeah, I ain't trying to take no class, so I'm trying to. I have to pivot because actually I'm kind of glad that I came to that realization because I was fine. I was going to launch the CDI course, but that really might be better launched in September
Mm-hmm.
when people are, because I was like, because I had people who were like, "What's the date again?" They were like, "No, I'll wait till the fall." So I'm like, "Okay, that's my clue." They trying to have a hot girl summer. So
Aha!
I'm like, "Okay."
Sir. Well, they better stay masked up. Let me be the witness. Hot girl, whatever. Be hot, but be hot in that damn mask. Let me just say. I still got trips that I'm supposed to be making, but trust and believe me, if you even see me on the beach, I'm gonna have a mask on. I'm not playing. Like, oh my God, they tried to take me out. But anyway, that's good to know as well. Yeah, because this is our first kind of official summer, and we're out here Memorial Day weekend, and this is when families get together and all of that for outside. But the good thing is it's primarily outside. It's grilling and
Right.
all of that stuff. But you do have people to be like, I ain't going out there. It's hot. I'm staying in the house. So you got to be mindful of that as well. So yeah, yeah. Well, cool, cool. Well, I'm glad everything is working for you. Um,
Yes, thank you.
so of course, last but not least, to my Clubhouse folks, don't forget to click on the little green Clubhouse to join in the fun in our club, and you will get notified of our live broadcast, which is on Saturday mornings at 9 a.m. Eastern Standard Time. So, again, this has been a great session today. Thank you all for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and thanks so much for joining us. Have a
Okay,
great
bye bye,
weekend.
everybody.
Bye bye.